Hello and welcome. I'm Ellen Sutherland and here we are, being spiritual. I've been giving you a number of blogs on tapping and it still doesn't feel nearly complete to me, and so I thought we could try one more, and this is a demonstration on test anxiety. So in my life right now, somebody's 80-year-old mother is going through her written driver's test and has a fair bit of anxiety about it. But there are many thousands, hundreds of thousands of students who have test anxiety, exam anxiety, oral exam anxiety. And tapping really is such a help in those situations that I feel it would be really wonderful to just run through quite quickly to show you how quick it can be done. Run through quite quickly a tapping for test anxiety. Okay, so let's try it. Let's go. Alright, so the first thing we have to do is to focus on the test. So if you're doing it right now, that's one thing, but usually you're thinking about having to do this test. I have to do this written test for my driver's exam, or have a midterms, or have end of terms, or have finals, or any of the exams that we can have, A-levels, O-levels, all sorts of tests. And life has lots and lots of tests, so it would be wonderful to get rid of this anxiety or have a tool that will help with it. Alright, so the first thing you do is focus on the situation. Imagine having to write your test. Imagine walking into the room and having to write your test. So on a scale of 0 to 10, where's your anxiety? Well, it might be a 7. You just feel the anxiety rising up in you. And notice where it is in your body. It's very helpful if you can do that. Maybe in your stomach, you may hold it in your shoulders, in your jaw. You may wrinkle your forehead or tense your eyes. You may tense your hands as you're writing. Wherever you hold it, that's the way it is for you. So focus on all that. Get your number. Remember, tap on your karate chop point and do your psychological reversal. So this is the part of you that doesn't quite believe tapping will work, or you're never any good at exams, so you're going to fail, or whatever your negative belief is back there that thwarts being successful at this. You're always anxious. Maybe you should be anxious when you're doing a test. Whatever your belief is. So even though I have these feelings, these anxious feelings about doing this test, I deeply and profoundly accept myself. Even though I have these anxious feelings, these horrible feelings in my neck or my stomach, wherever they are, I deeply and profoundly accept that's the way it is for me right now. Even though I have these anxious feelings, I accept that that's the way it is. Okay, so then you tap on whatever your label for it is. This test anxiety, these anxious feelings, these awful feelings, these oral exam feelings, or these test feelings, these anxious feelings, these test feelings, these awful feelings about tests. And take a deep breath. Think about going back to that test now. That walking in the room or writing the test. Think about it. Is it the same? Is your anxiety the same? Is it down? Usually it's down. So if it was a 7, maybe it's a 4 now. Maybe it's a 2. Maybe it's just a little bit. Maybe it's stayed the same. If it stayed the same, you need to go and reassess your psychological reversal. You need to dial in again on the feelings. Imagine yourself being in the test. Make sure you're right there, and then do the psychological reversal. But usually it's gone down, and we're going to assume it's gone down. So maybe it's a 4 now, this 4 feeling. So then you would just tap again. These leftover feelings, these leftover exam feelings, these leftover test feelings, these leftover feelings about writing the test, these leftover feelings. I'm holding on to these leftover feelings these leftover feelings, these leftover feelings. Again, take a deep breath. Sometimes you'll yawn, sometimes you'll sigh, or you'll feel just a shift in yourself, that anxiety is lifted, has shifted, has moved away, feels different, quite significantly different. So again, assess yourself. Imagine going to the test. Imagine being there and writing it. How do you feel? So it could be gone. Often it is gone after the second round. Sometimes another aspect will come up. So maybe you no longer think about writing it as being difficult, but then you think about forgetting, or perhaps when you're in the test, your mind blanks out. So that would be another aspect, and you would tap on that. And in the same procedure, focus in on the fear, the upset, the anxiety. Measure it on your scale. Do your psychological reversal. Even though I have this test anxiety, even though I have this fear of blanking out, whatever it is, and then tap through it. Assess it again. Check on your anxiety level, see if it's up or down. If it's gone completely, you're done. If it's down, then you just tap through again, but saying this leftover feeling, or holding in mind that this is leftover feeling, it's not the same. And then reassess. Try and breathe in between. You notice I do it quite quickly. You don't have to do it slowly at all. And why don't you have to do it slowly? Because we're hitting one of the meridians or two of the meridians that are blocked. It could be this one or this one or this one. And all you're doing is unblocking them as you think about the issue. So you don't have to do anything slowly and calmly. You just look through it. Don't hit yourself like you're drilling for oil. Gentle tapping is fine. And so there you go. You can play with that. Play with that. Just the important thing is that you need to be really dialed in, really focused on the issue, and that you get to a zero. No anxiety when you think about the issue. Now, be aware that you're not thinking about some other issue, because as one leaves, another might pop up. You go back to that issue that you've decided to work on. You may write it down, the test anxiety issue. Go to that issue and be sure it's a zero before you move to the next. So I hope that's helpful. That's helpful for all of you going through any kind of oral or written tests. You can relieve yourself of this incredible anxiety. It gives you more oxygen to your brain and allows you to live in a more peaceful manner. Peace to you.